EULAR, the European League Against Rheumatism, is the European umbrella organisation which represents scientific societies, health professional associations and organisations of people with arthritis and rheumatism throughout the whole of Europe.
The mission of EULAR is really about improving the quality of life for people living with any form of rheumatic disease.
But it is also to improve the treatment, prevention and rehabilitation of musculoskeletal diseases.
So EULAR's work brings all of these groups of people together under one roof, and by doing so promotes collaboration and a coordination of activity which I believe makes it particularly effective. It also makes it a natural partner for institutions, not least the European Parliament and Commission, because by talking to EULAR they can speak to an organisation which has one voice to offer, a voice which is coordinated and harmonised.
EULAR supports research projects in rheumatology by funding collaborative research between European rheumatology groups.
And it's with this in mind that the EULAR standing committees seek to produce guidelines and recommendations on what it describes as best practice, based not only on best available evidence, but by the active participation of all parties.
Another important activity for EULAR is education and training.
Every year EULAR sponsors a number of educational grants and bursaries for scientific researchers and clinicians, health professionals and people with arthritis and rheumatism. These are tailored to support experts in developing their skills and expertise and in broadening their network of contacts at the European and at the international level.
Furthermore, EULAR offers an extensive program of traditional and online educational workshops and courses for trainee and specialized rheumatologists.
Over the years, EULAR has strengthened its image as the representative umbrella organisation in Europe in the field of rheumatic diseases and unites scientists, clinicians and patients, and thus stands for a comprehensive representation of research and patient needs in Europe.
So in many ways, EULAR is seeking to be as effective as we can, both on the scientific and medical aspects, but on the broader, wider social issues, which of course are just as important for people living with rheumatic diseases.
The European Parliament has now recognized the extraordinary importance of rheumatic diseases.
It was in October 2009 that the first special interest group, all-party group, of parliamentarians was formed specifically to look at the wide range of issues involved in EULAR's work and which affect people with rheumatic diseases generally. In my view, it's successful partnership work which makes EULAR so often so effective. And the close involvement of health professionals, clinicians, researchers, but perhaps critically, patients, is I think what makes EULAR unique.
Health professionals in EULAR, that is the nurses, the physiotherapists, the occupational therapists, the psychologists and other health professionals involved in treatment and care of people with rheumatic diseases, have made major progress during the last year. However, there are still great challenges, and I'm personally convinced that the everyday life of patients with rheumatic diseases will improve also over the coming years.
At a personal level, if I were asked for a slogan which represented EULAR, I think I would say, "We are stronger together." As groups, we come from diverse backgrounds, diverse countries, but we work extraordinarily closely together, and I think to the benefit of all, and most of all, people with arthritis.